Diana Awuor. So this is coming to talk about something specific that is in research right now. And I'm going to talk about a study that has been done recently, and it is in relation to breast cancer hormone therapies, hormone blockers. So yesterday when I mentioned that I was going to talk about hormone blockers in relation to type 2 diabetes, there was someone in my audience who was watching, and she told me, hey, I had hormone blockers for 4 years and I have type 2 diabetes. And I asked her, please, I need you to respond. I want you to answer my question. Did you have type 2 diabetes before the breast cancer and before the hormone blockers? Or did you have the type 2 diabetes after the hormone blockers? When this lady replied me, she told me, I had type 2 diabetes after breast cancer. I had type 2 diabetes after using the hormone blockers. Okay? And that is why I am coming live today. If now, I had breast cancer in 2020 and I was diagnosed with a tumor that was called heterogeneous tumor. Okay, I would say I am one of those unlucky people that had a very rogue type of cancer tumor, because the tumor that was in me was a tumor that had 2 types of breast cancer. Breast cancer is unique. Not everybody has the same type of breast cancer. Breast cancer is of different types. There's some breast cancer that depend on estrogen to grow. They have estrogen receptors. There are other breast cancer that has progesterone receptors. There are others that have HER2 receptors, and then there's another bad one that has nothing, that has been discovered. So that one is called triple negative. Okay, now the breast cancers that have hormones are normally given hormone blockers. Okay, once you have done your chemotherapy and you have done your radiation, you are given medicine that you will take that will prevent your ovaries from producing estrogen. If you are a woman who is on menopause, you will be given medicine that will prevent another hormone from being changed to estrogen. So they want your body to be free of estrogen when you had estrogen receptors. And that is what I'm talking about today. Estrogen receptors and the medicine that is given to us to prevent the formation of estrogen in the body. All right? Now, I was given a medicine called anastrozole. If I think there could be somebody here who was given anastrozole also, because anastrozole is given to women on menopause. Yes, I look young. I am young. I am 39. I was diagnosed with breast cancer when I was 36. But when I was diagnosed with breast cancer, I went very harsh on the cancer and I decided to take out my ovaries. I took out my ovaries because ovaries produce almost 98% of estrogen in the body. So I needed to do away with estrogen. Okay, so I took out my ovaries. So that automatically put me on menopause. Now, when it put me on menopause, I qualified to take the medicine that is given to women who are on menopause. So I took anastrozole, but in the past 2 to 3 weeks, the medicine was changed to a different one. I don't know the name of this new one offhand, but I have it in my medicine basket. But it is still medicine meant to block estrogen from forming. Now, those medicines cause a lot of pain in the body. When I used to take anastrozole, I had bone pain, a lot of bone pain, and my bone density reduced drastically. If you don't exercise or you don't lift weights, I did not do that for the past 3 to 4 months, which caused my bone density to reduce. Okay, so I had to be changed, and right now I'm about to start my bone treatment. I took out all my wisdom teeth because I am getting ready for bone treatment. But that is not the topic for today. The topic for today is research that I just found. And this research was done at my employer, at my university right now. The topic of this, and I just saw this in the newspapers, and I was like, wow. College of Medicine researcher explores causes of type 2 diabetes. Causes of type 2 diabetes after breast cancer treatment. When I mentioned that yesterday, a woman in the audience told me, I got type 2 diabetes. And I was like, did you get it after taking the hormone blockers? She said, yes. So guys, this is what this research was about. This woman, her name, and I'm going to look for her. I want to bring her here to this show. Her name is Dr. Elizabeth Welberg. She is a assistant professor of pathology. Okay? She works at the University of Oklahoma. I work at the University of Oklahoma also. So Dr. Welberg did her research on the relationship between the hormone blockers and type 2 diabetes. And for her study, she used rats, okay? They start off normally, of course, they start off with rats or guinea pigs. So the rats were given the hormone blockers, and she gave them the one they give the premenopausal women. What's the name of the one that they give the premenopausal women? I always forget the name. Whatever it is, the hormone blocker they give women who are not on menopause. So the study found that the rats that were put on that medicine, the rats developed, and let me read this out to you. Let me read this out to you. Okay. In her own laboratory, she has demonstrated that the drugs change the metabolism of mice. The drugs change the metabolism of mice in a way that is similar to pre-diabetes in humans. You see what the medicines do? Anastrozole and the other one that they give to premenopausal women. They cause the metabolism of people to change, and the mice metabolism changed to be similar to pre-diabetes in humans. Type 2 diabetes. What is this research saying? What are their recommendations? They say that not everyone who is treated for breast cancer ends up developing diabetes, but it's not rare. It is common. For women who are treated for breast cancer and are given hormone blockers. Hormone blockers are medicines like anastrozole. These hormone blockers are normally given to prevent the ovaries from producing estrogen, or prevent the body from changing other hormones into estrogen in the absence of ovaries. Okay? So people who take these hormone blockers, myself included, Diana included, we are at risk. We are at risk of type 2 diabetes, because these medicines go and change our metabolism. And this is a study that has been conducted on mice. It has not been conducted on humans yet, but already for a study to happen, it means a scientist or the researcher has seen a commonality and has seen something similar happening to women who are taking that medicine. And so they proceed and do the research on mice or on guinea pigs. And once they establish that there is a relationship, then they are now going to proceed and take humans into that study. Now, I am so happy that this study has been conducted at the University of Oklahoma. And I know that I'm somebody who pushes. I am pushy. I am going to push until I find this woman this professor who has done this study, and I want to bring her to this show. And if she accepts, I think I will do somersault and I'll do press-ups and I will scream and I will jump and I will run. Because this is a very important study. What does this study want us to do? What would I advise somebody to do? And what am I going to do? What I'm going to do is this. I am going to send this study to my professor. I am going to send this study to my doctor, my oncologist, and I'm going to tell my oncologist to start monitoring me for diabetes type 2, for type 2 diabetes. And that is what I would advise any other breast cancer patient who is watching me right now or who may find this video on YouTube. Because one link to this study, reach out to me on email and I will send you the link to this study, because this study is important. You need to send this study to your doctor and ask your doctor to start monitoring you for type 2 diabetes. This study, this professor says, you don't have to have a history of diabetes in your family. As long as you have taken hormone blocker medicine meant for treating breast cancer, then you are already at risk of type 2 diabetes. Okay? This is a very, very important study that I wanted to talk about today. To cancer treatment. Cancer treatment, you're treated for one thing which leads to another thing. One thing which leads to another thing. So it is normally very, very important. It's very important to know and to let your doctor tell you. You know, whenever I started my treatment, when I went for my chemotherapy, I was given a booklet. I was given a booklet that had the name of the medicine, what is intended to do, why I'm being given that medicine, and the side effects of that medicine. And I was required to read all these things and understand them. And I was given counseling related to some of the side effects of those medicines. And one of them is carboplatin. Mimi's General Stores. I am never for that statement. I don't embrace that statement. I don't embrace that statement. That is a very reckless statement. Chemotherapy kills people. That is reckless. And it is for people who are not aware. And that is why I come live. Chemotherapy does not kill people. Lack of good nutrition kills people. And that is the information that is important. When you're going for chemotherapy, you need to have good nutrition. And good nutrition means you need to be eating your lean proteins. You need to eat healthy. You need to eat a lot of good vegetables. Because I did chemotherapy. Whatever you see here on my chest, this was my chemotherapy pot. I did chemotherapy. I am not dead. I did chemotherapy in 2021. I am not dead. But I almost died. I am not dead, but I almost died. I almost died because of my stubbornness. Because I was not eating what I was told to eat. I almost died because my doctor told me I needed to eat salmon. I needed to eat goat. I needed to eat kienyeji, chicken. But I refused. I said no. I cannot eat those things because they're the ones that caused me to get cancer. I said I am only going to eat beans and I will only eat lentils because I am not eating anything from an animal. But I had sickle cell trait. I am a sickle cell carrier. So half of my blood is sickle. Half of my blood cells is like this. So I needed my blood to be formed quickly. So when I missed chemotherapy twice because of my stubbornness, I went and my husband bought salmon, very healthy fish that cannot be GMO, from the deep sea. My mother brought for me omena, and I ate omena. And I ate goat. What I don't put in my mouth is cow. I don't eat beef. I cannot eat beef. If you've ever had cancer, don't eat beef. Even if you've never had cancer, stop eating beef all the time. Beef causes a lot of free radicals in your body, and those are the things that cause cancer. So chemotherapy does not kill. What kills is poor nutrition during chemotherapy. So I need you guys to change that statement. Stop preaching the word chemotherapy kills. That is the statement that causes people to refuse to go for chemotherapy. Because they hear a lot of chemotherapy kills, chemotherapy kills, chemotherapy kills, chemotherapy kills. And so when they get cancer, chemotherapy kills, so they will not go for chemotherapy. So let me ask you, if you have cancer and it is going to kill you, and then you refuse to take chemotherapy, so what game are you playing? So what needs to happen is you have to know what is good nutrition, especially during chemotherapy. You're talking of statistics. I am learned, by the way. Did you hear? I am a doctor of education. I know statistics. I do a lot of research. I know statistics, my dear. If we want to sit and talk about statistics, I know statistics. And I know many people die. They don't die from chemotherapy. They die from poor nutrition during chemotherapy. Chemotherapy is chemical, is poison that targets fast-growing cells. And when it comes to your body, cancer is not the only fast-growing cells in your body. The nails normally turn black. Why do the nails turn black? Because the cells concerned with the nails are also fast-growing cells. Why do most people lose their hair during chemotherapy? Because the hair cells are also fast-growing cells. So the chemo is going for other good cells also. How can you help yourself? By eating healthy so that your good cells are formed quickly. If you are on poor nutrition, then you will die during chemotherapy because you're on poor nutrition. But if you're on good, healthy nutrition, then you will survive.